In that health care task force, one of the issues that came before us was the fact that Idaho ranks about 50th or 51st, including the District of Columbia, in the rate of childhood immunizations. We also rank, about 40% of the babies that are born in Idaho are born on Medicaid. It is the taxpayer's responsibility to care for those babies, not only for their birth, but then they're going to be placed on public assistance after their birth. And by having these children immunized, they're going to have less childhood diseases. Some of the other states have a program on their immunization registry, which is it's a system where people are notified when their immunizations are due, and doctors can check to see when immunizations are due. You know, my dog and cat, I get notices from the vet when their immunizations are due. And that's the least we can do for our children. If parents decide that they do not want their children immunized, that's fine. There isn't anything that makes parents accept being placed on the immunization registry. There isn't anything that makes them have to have their children immunized. They can opt in at any time, they can opt out at any time. The idea is to help bring up our immunization rates. The other states that have done this have found success in that. We felt on the healthcare task force that the records weren't being kept properly. And by the records not being kept properly, gave Idaho a bad ranking. That we thought if the records were maintained and reported, then we could be in the middle where we want to be, and wouldn't have the bad reputation of not taking care of our children. The three bills, the first bill was the opt-out legislation, 1335. Then we had legislation where the insurance companies would pay for the immunizations for children, would pay into a fund so that we could get the immunization, the vaccines at a cheaper price, so that the children could have the immunizations for free. And then the other one was the it created a committee to choose. Thank you very much. Yeah. But those were the three pieces of legislation on immunizations that should make a difference in our immunization rates.